Coming up on this episode of the Paw Report, we discuss veterinary epidemiology and talk with a veterinarian with the University of Illinois working to prevent outbreaks like COVID and Lyme disease. So stay with us.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
And welcome back, and thanks again for joining us for this edition of the Paw Report. Today, we're talking about something we haven't broached on the Paw Report in a while, and that is epidemiology. And we're joined by first-time special guest, Dr. Yvette Johnson-Walker from the University of Illinois. So we welcome you to the program for the first time. And when we met in the hallway, I said, "Oh, you got my message. We're both dressed in beautiful blue
uniform
today."
Yes.
Thank you so much for joining us. It's a pleasure to have you, and thank you for driving down from Champaign-Urbana to be a part of the Paw Report program.
Well, Kelly, thanks for the invitation. It's great to be here, and there's nothing I like more than talking about epidemiology, so I'm excited to have a new audience.
Well, good, and we want to know a little bit about you, since I always put first-time guests on the spot so that they can get to know the viewers a little bit more.
Sure. Well, I'm an Illinois girl at heart. I'm originally from Chicago and came to University of Illinois at Urbana for undergrad, where I majored in animal science and then stayed and completed veterinary school. And then after that, actually hung around a little longer and did a master's degree where I worked with dairy producers in Kenya, and they were trying to identify constraints to increasing domestic milk production. And that's really how I fell in love with epidemiology. And so after that, I completed a PhD at Michigan State University in epidemiology. And now I'm on faculty at University of Illinois, where I teach epidemiology, public health, and food safety.
You've mentioned epidemiology quite a few times. What is it? Let's talk about the heart of what that subject matter is.
Well, the basic principle of epidemiology is that disease is not a random event, that each individual has certain exposures or characteristics, risk factors, genetics that may increase or decrease their likelihood of having a disease. And so as epidemiologists, we're often described as disease detectives. We're trying to figure out the who, what, where, how, and why. We want to know who's impacted by the disease, so who's at risk, how it happened, when and where it's happening, and then understanding the why it's happening to those particular individuals. Why are those individuals at greater risk? And then use that information really to develop control measures, to develop preventive programs. So if we identify someone's at increased risk for genetic reasons, maybe we want to screen them early in life and start them on preventives earlier on. If we identify that certain exposures or occupations put an individual at increased risk, then we again want to do screening with them early and intervene and maybe change those exposures to try to prevent disease.
Let's take it a step even further. Veterinary epidemiology, which is your specialty. What do you look for in that arena?
Well, so the beauty of epidemiology is we just need a community, a population. As a veterinary epidemiologist, I'm often focused then on the animal component of that population. And so whether it's looking at disease and health in animal communities or looking at the role of those animal communities on human disease and health. As a veterinary epidemiologist, I do a bit of both.
Mm-hmm. getting into the heart of our discussion, how vulnerable is really the world to disease, zoonotic diseases? And when we talk about that, there's a couple that just jump out at us. Kovid would be one. Yeah. West Nile, Lyme disease. Given those, I mean, I think we were pretty vulnerable, but in your studies, are we at risk?
Well, we've always been vulnerable to infectious disease, and zoonotic infectious diseases are those that can spread from animals to humans, and so that's always been a part of the dynamic when we look at health of human and animal populations. A lot of changes in our behaviors have happened that have, within the past 3 or 4 decades, increased the emergence and re-emergence of some of those zoonotic infectious diseases. And so when we think about human population growth, which then results in humans encroaching onto wildlife habitats and environments, then we see increased opportunities for spillover events from wildlife populations into domestic animal and human populations. When we think about global and international trade and travel, that someone or something that's sick or contaminated in one part of the world can be in another part of the world in a matter of hours before they even know that they're sick. And so the potential for disease to move great distances is great. And then climate change. Climate change is changing the relationships between insect vectors and hosts and their habitats, and we're seeing more and more extreme weather events, and human populations are moving. So all of those dynamics are changing and increasing opportunities for exposure to things that we'd never been exposed to before. And so new diseases are one of those inevitable outcomes from those changes.
Let's talk about Lyme disease, West Nile. Even you'd mentioned SARS before we actually started recording, and then delving into COVID. Looking at all of those different diseases, do they all have a common component, and that being of the animal population?
They're all zoonotic, and so they all start out in an animal population. They all have some situation where there's a spillover event where it leaves in that animal reservoir where the virus normally resides and enters into a human population. And then what ends up creating widespread disease is often where there's person-to-person transmission or where there are insect vectors involved in transmission. And so when you think about all of those diseases you just mentioned, they've got those factors in common. Lyme disease is spread to humans from ticks, and primarily deer ticks. And so when we have urban and suburban sprawl, primarily into areas that were previously agricultural that are now converting into residential communities. And so you've got deer, you've got the deer ticks, and then you've got people and their pets in close contact with the deer and their ticks. And so the opportunity again for disease to move from the wildlife to the pets and to the people through that exposure. With SARS, severe acute respiratory syndrome, again, it appeared in China, and we saw cases where, again, that initial spillover event entered into human populations, and then it ended up being a very transmissible disease that then spread person to person. And with international travel, a lot of the major cities quite distant from where it actually emerged then had cases. In fact, Toronto, Canada was severely affected by cases during that SARS coronavirus pandemic. Smaller scale pandemic, not nearly as many cases, but over several continents. And now we see a new coronavirus that has emerged, which is the COVID-19. And all of those factors, again, play a role where there's exposure to an animal pathogen into a human, where there's that spillover event. But then once that happens, person-to-person spread and international trade and travel can result in then disease spreading over huge geographic areas in a short period of time.
I think now is a good time to maybe address, and I have discovered this in some of your writings and research, the concept of One Health. Can you discuss what that is and how that plays in with health of people connected to the health of animals and why that's important.
Sure, and One Health is not really a new concept. If you look in the literature, you can find references and quotes by naturalists and scientists referring to One Health back to the early 1800s, where we're talking about the fact that the health and well-being of humans, animals, and the environment are all interconnected, and that anything that has an impact upon one of those members of the triad is going to have an impact upon the others. And so we're interdependent. We need each other. And when we think about policies and interventions, it's important that we begin to look closely and consider, well, what's the impact of this intervention on human health, on domestic animal health, on wildlife health, and on the ecosystem that we all live in and share? Because whatever policy we're putting forward is not going to be sustainable if it has negative impacts on the other components of the triad. We've got to try to work at enhancing and benefiting all three components to have sustainable change.
As we talk about One Health and animals to humans and humans to animals, I think the one topic that has been on everybody's mind for the last year and a half and continues to be is COVID. Was that something that was long predicted, expected, kind of out there hanging like this could be a possibility in our society?
I think that's one of those situations where there's constant research and constant searching for the next potential agent that may cause widespread disease. We commonly track influenza viruses, and whenever there's a novel influenza, especially one that's zoonotic, so maybe from avian source or swine source, and then people may be susceptible to those. We're monitoring those. Because of the advent of SARS, which was then followed by MERS, the Middle Eastern Respiratory Syndrome, both of those were coronaviruses. We were looking for new coronaviruses that may indeed cause problems, health problems for animals and humans, and may be transmissible between the two. But there's a constant search because we don't know all the wildlife reservoirs that may be carrying pathogens that are transmissible to us. We don't know all the pathogens, and so we're constantly searching. And it's a dynamic situation that the hosts are changing, the viruses are changing, and so the environment is changing. And so because of that, what was true 10 years ago may no longer be true. And so the same agent may have changed so that it has a different impact on the host, or the host may now be more susceptible because of other changes. And so we've got to continue, it's a continuous monitoring process to look for what's going to be the next agent that becomes a severe public health crisis for the world.
Your answer is interesting, and it leads me into my next question. Do we really know currently how many viruses, diseases are out there within birds and other mammals? I mean, is it, I would speculate to say there's probably thousands.
An untold number. We really don't know. And unfortunately, the diseases often appear in areas where there are limited resources, where populations are vulnerable, and where perhaps there's not a lot of research being conducted to try and find these agents. More and more multinational organizations are working on doing some of that searching. The World Health Organization, NIH, and the CDC are all involved in working in communities where they're looking for the next pathogen. The World Health Organization usually tries to keep a list of the 10 things that they're worried about, but disease 10 is the unknown. It's the one that we haven't found yet. And so there's always a concern that there'll be something new that emerges that we're not as prepared for.
This next question may be hard to answer, the latter part of it. Zoonotic diseases increasing, and what do we do? What do we do? How can we prevent them from continuing?
I think there are a lot of things that we can do to prevent the type of large-scale pandemic that we've seen with COVID-19, at least at the policy level. And some of that is understanding the importance and interrelatedness of that human, animal, and environmental health. And so policies that enhance biodiversity, that maintain pristine wildlife areas are going to be important for trying to prevent some of that exposure. Whenever we can reduce human encroachment into those habitats, we need to work in those areas. And again, increasing biodiversity seems to reduce the chance that we'll have those spillover events into human populations. I think the other part is going to be disease surveillance and monitoring. We really need to work more toward an integrated and coordinated system where we're looking for disease in humans, domestic animals, wildlife, even plant life, and communicating across all of those sectors to make sure that if something happens in a wildlife community, that physicians know that perhaps we should be aware that things may change for humans and be on the lookout for human cases. If something happens in humans, veterinarians need to know that they may need to look for this disease in their animal patients so that we can find out earlier and stamp things out before they get so out of control. Because that spillover event is usually a sporadic event, limited scope and scale, and if we don't allow that large-scale person-to-person transmission afterwards, we can control things before they get out of hand. But it needs more surveillance and monitoring, more communication across human health, animal health, and environmental health sectors so that we're working in collaboration and understand what's going on in all of those communities because, again, we're interrelated. So it's going to impact the other sectors, even if right now we're only seeing it in one. And often, wildlife and ecosystem health is where we see the first warning signs. And so acting when we see those changes before we see it enter into human and domestic animal populations can help in our ability to respond to some of these events.
Really sounds like we need more of you. We need more veterinary
well,
epidemiologists.
We definitely need, you can never have enough epidemiologists.
I mean, I know that this may sound like a strange question. I don't mean to put you on the spot, but are there many veterinary epidemiologists in the country that are really, and maybe that's one of the solutions, is seriously needing more people to do research on these types of issues?
You know, it's a pretty small group. We mostly we know each other, communicate, and get together and have meetings. One of the things that the University of Illinois has done is they've got a joint degree program, the DVM Masters in Public Health, and that's been really effective at identifying students who are interested in veterinary medicine and exposing them to the public health component of it, which really is the foundation of what's going on with epidemiology. That's the science behind public health. And so had quite a few students who've completed that program and then pursued careers where they're working at that nexus between human health, animal health, and the environment and trying to learn more and prevent disease in all three sectors. And so there are programs at other veterinary schools that are similar, and so there are opportunities for students that are interested in animal health to understand. We really, as veterinarians, we understand population health better than other health professionals because we are used to working with a herd or a community, a flock. And so epidemiology is really a natural pathway for a lot of those students.
You touched on it in one of your previous answers, but I'm gonna directly ask the question again. Can we be better prepared for future pandemics? COVID, I guess, is on the forefront, but talking about influenza, SARS, West Nile, how can we be better prepared? What do we need to do?
I think COVID-19 has taught us a lot of lessons that will help us be better prepared for the future. I think one of the first lessons really, again, was how interconnected we all are, not just humans and animals, but then as a society. And so a lot of those essential workers were often low-wage earners, but we realized that the economy, our lives, couldn't function without the person at the grocery store and the person driving the bus and all of those other jobs that we often don't necessarily, at least in terms of compensation, maybe don't adequately value. But then those are also often the people that had disproportionate impacts from the disease, were more likely to suffer illness and death, more likely to suffer financial difficulties. We've got to recognize and value that sector of the economy and make sure that people have access to health care, because in the long run, again, it protects us all. And so having access to health care and a living wage for those essential workers is really going to be important. As a parent, I hadn't really thought of the services that the school provide for all the children, and that the idea that if school was closed, then some students didn't have access to food, and students didn't have access to physical therapy or to their social worker. And so understanding some of those interrelationships is really going to be important as we move forward and think about how are we going to be prepared to respond in a way that addresses those issues. I was talking to colleagues on a conference call this morning about the fact that even though livestock and poultry, so cows, pigs, chickens, were not impacted by COVID-19, they were impacted by the pandemic, because when the workers at the processing plants were ill and not coming to work and processing plants were shutting down, farmers didn't have a place to send those animals that were ready to go to market. And so we couldn't identify any other time in history when producers had animals that were ready to go to market and we didn't have any place that we could send them because of a human health crisis. And so even if you're not a susceptible species, when one component of that triad is impacted, it has ripple effects that impact us all. And so thinking about those kinds of things when we start looking at how can we plan for the future is really going to be important.
What else have we learned from COVID? The social aspect, you just kind of identified, but human health, animal health, what have we learned?
I think another reminder of the fact that we are all interconnected and interrelated, that zoonotic disease can go both ways. And so some of the animal species that were impacted, like pet cats and big cats in the zoos and things like that, they got it from people. So remember that your pet is a part of that household. And so what you have, if it's transmissible to your pet, then they may be at risk. And what they have, if it's transmissible to you, you may be at risk. And so we really need to keep the dialogue open between physicians and other human health care professionals and veterinarians, so that we're, again, taking care of the health of the entire family, because we are so close. I think so many people got a pandemic puppy, to kind of help emotionally. We recognize that they're part of the mental health and well-being of the family too. And so we need to be prepared, again, to make sure that we're taking adequate steps to protect the health of all the household members, human and animal. I think that was, again, another big take-home message from the pandemic. The other one is thinking about, so suppose it had been a disease that impacted livestock and production, and how would that have played out, and what measures would we be able to put in place to respond to that? And that's actually a project that I'm working on now. We have a grant with the U.S. Department of Agriculture for preparedness for livestock producers in the Midwestern region. And we're working together to start thinking about some of the ways in which the livestock industry would respond. And again, the economic impact would be absolutely devastating, but then also the mental health and well-being of producers and consumers, and the welfare of animals would be placed at risk too. And so looking at how can we find solutions and ways to address these that benefit, again, humans, animals, and the environment are really where we're looking at working forward toward the future.
No small task, and I can only imagine your wheels are constantly turning with research and studies and ways to solve. So thank you for spending a few moments with us here on the Paw Report to talk about veterinary epidemiology and other preventative measures and things that all of us as a society can do moving forward. It was a pleasure meeting you and speaking with you today.
Well, thank you for having me.
And thank you, our viewers of the Paw Report, for joining us for this episode of the Paw Report. Until then, we'll see you next time. I'm your host, Kelly Goodwin.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.